Yes. Hello. I'm talking about nurse. Nurse grades. Nurse working in a hospital have the following grades. A student nurse is a nurse who is still in training, and staff nurse is a nurse who has completes the training course. Chain nurse as more experienced nurse who is chains of responsible for a work of the department. Nurse managers is a nurse who is in chains of several guards. No, the old term sister is still sometimes used for families. Chains nurse, a female nurse managers may be called matron. Dr. Jim is talking to Sister Watkins. The supports working. The clinician supports working who has done a short course and obtained basic qualifications, and the nurse's auxiliary who is usually unqualified but assists nurse staff. There may also be ward clerk whose duty includes making sure patient notes and information are up to date and answering the telephone. Specialization. Like doctors, nurse can specialize. A midwife has specialized from the beginning by dawn. Of course, in my wife, they management of pregnancy and childbirth. District nurse visit patients in their home. Health visitor also work in the community, giving advice of the promotion of health and the prevention of illness. The nurse roles. The nurse roles has changed considerably in recent years. In addition to general patient care, checking temperature, pulse rate, and blood pressure, changes raising, giving injection, and removing suture. Nurse now do some of things previously reserved for doctor, so as prescribe drug and other laboratory tests. More responsible for nursing planner as the following article demonstrate. Nurse carry out surgery in effort to cut patient waiting lists. Nurse is a Scotland trainee to perform minor surgery has interest the operative there. For the first time in an effort to cut patient waiting time, five nurses who has passed a new course as a glance Caledonia University are not qualified to carry out such procedure as the removal of molation being small and seat. The verb perform and carry out are used with a type with all type of procedure. They are often used in the passive form. Perform and carry out an examination, an operation, and pursue an experiment and a test and an biopsy. The procedure was performed and carried out by a nurse. Alliance health professional. Community health. The health of the community depends on a larger number of people other than medical practitioners or nurses. This can be grouped under the heading of alien health professionals. They include the following physiotherapy, physio, help people to move by getting them to do exercise or by training. They body with head kit of massage, streaming by manipulate muscles and joints with the hands. Occupation therapy (OTS) help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally, for example, blindness or deafness. Social work help people to solve their social problems, for example, poor houses of unemployment or family problems. Chiropodist, also known as podiatrists, Straight condition affect the feet. Technician. There are a number of technicians, people who with scientific equipment, such as radiography, who are not an X-ray technician, ambulance technicians, where is emergency medicine service, an ambulance technician with more advanced qualification, and calling a paramedic. Prosthesis and prosthesis and orthopedic. Prosthesis and orthopedics provide care for anyone who needs an artificial limbs, a prosthesis, or a band to support a control part of the body, and an orthosis. They also advance in rehabilitation, helping patients return to normal life and work after training. Prosthetics provide artificial replacement for a patient who has an amputation or were born without limb. Orthotics provide a range of splints and other devices to aid move correct deformities from a normal development or part of the body. For example, clubfoot, talip, and relief pains. Optician tests eye sync and prescribe glasses, also known as spectacles and contact lenses, when necessary. The examination includes measuring intraocular pressure, the pressure in fluid inside the eye, and examining the retina. If the optician supports an eye disease, such as a glaucoma, they refer the patient to the GP for treatment. The GP mainly refers the patient as ophthalmology as a doctor who specializes in disease of the eye. Hospital. Introduction to the hospital. Jordan Paz is a 4 year medical student from Barcelona. He has come to Britain of an elective attachment to the Royal Infirmary in Edinburgh. Dr. Barrow introduced him to the hospital. Dr. Barrow, the Royal Infirmary, is the name of the University Hospital for Edinburgh University. It's a general hospital. They live with a type of patient and illnesses, except pediatrics. We have a specialized hospital for that is another part of the Edinburgh. The hospital for sick children. You can see some of the department in our hospital of the sick. Sick. Of course, there are many other, for example, the intensive care unit, ECU, and the surgical high dependence unit, HDU. Jordan, what does outpatient means? Dr. Barrett, outpatient are the people who come to hospital, they attend a clinic or to have a test or treatment and then return home on the same day. An inpatient stay in the hospital for one or more days. The room where they stay are calling warn. If a patient's treatment require only one day, so as simple operation, they can be admitted to the surgery unit. Welcome to the Royal Infirmary. Souls and trains, car parts, the ED, visceral and staff. The Sensor Center for Reproductive Health, gynecology, emergency, maternity, emerging, neonatology, emerging, our patient department, old guard, day surgery, unit endoscopy, a straight department, community assessment. Outpatient, Dr. Barrow, the accident and emergency department, A&E, also calling casualty, is where patient who has acutely with a sudden serious condition come for an assessment and treatment. Our patient who has appointment to see a specialist goes to a clinic, one of the outpatient department OPDs. They have usually been referred to the hospital by their GP, who has written a referral letter to the consult explaining the patient problem. Inpatients, Dr. Barrow, the inpatient in a hospital are admitted is one of the three main ways. They may be seen is one of the outpatient clinic and admits from there are. If there is a lot of demands for treatment, they need as is the case of hip replacement. They are put on waiting list for admission. Alternatively, the GP may arrange the admission by telephone because they are clearly in, for example, with suspense myocardial infarction, of they are seeing the AE department where the doctor on Dory working at that time around the mission. This could happen in the case of patients with a fractured neck or femur, for example, larger hospital may have a segment units where patient can be admitted temporarily while their condition is assessed. Jordan assessed Dr. Barr, yes. The decisions are made about their condition and what needs to be done. Help them. After treatment is complete, the patient is discharged back to the GP care. Thanks.